Hello, I'm Dr. Damien Lafferty, a surgical podiatrist based in Sydney, Australia. If you have chronic heel pain that has not responded sufficiently to stretching, footwear changes, orthotics or shockwave therapy, regenerative injections may offer another valuable treatment option. The two treatments I'll discuss today are Dextrose Prolotherapy and Platelet-Rich Plasma, PRP. These treatments are designed to encourage the body's natural repair processes. They can be particularly useful when heel pain has become chronic and the plantar fascia shows signs of degeneration rather than simply short-term inflammation. To understand why regenerative injections may help, we first need to look at what happens inside the plantar fascia. The plantar fascia is a strong band of connective tissue extending from the heel towards the toes. It supports the arch and helps absorb force when we stand, walk, and exercise. When it is repeatedly overloaded, small areas of tissue damage can develop. In the early stages, inflammation may be involved. However, when the pain persists for several months, the tissue may thicken and its collagen fibers may become disorganized. This chronic degenerative condition is more accurately described as plantar fasciosis. This distinction is important because chronic plantar fasciosis may need a different approach from a recent episode of inflammatory heel pain. Rather than simply reducing inflammation or temporarily suppressing pain, regenerative injections aim to stimulate a new healing response in the affected tissue. However, the first step is confirming that the plantar fascia is actually responsible for the pain. Not all heel pain is plantar fasciosis. Similar symptoms can arise from Baxter's nerve entrapment, heel fat pad pathology, stress injury, bone marrow edema, or pain referred from elsewhere. In my Sydney clinic, I combine a detailed clinical examination with diagnostic ultrasound. Ultrasound allows me to examine the thickness and structure of the plantar fascia and identify degeneration, inflammation, or small tears. In selected cases, an MRI may also be recommended, particularly when there is concern about pathology within the heel bone or another cause that cannot be adequately assessed with ultrasound. Once chronic plantar fasciosis has been confirmed, Prolotherapy or PRP may be considered as part of a structured treatment plan. Let us begin with Prolotherapy. Prolotherapy usually involves injecting a carefully prepared dextrose solution into the abnormal section of the plantar fascia. Dextrose is a form of glucose. At the concentrations used for prolotherapy, it stimulates a controlled local healing response. This may activate cells involved in tissue repair, encourage collagen production, and influence pain signaling within the treated area. A simple way to understand prolotherapy is that it attempts to restart a healing process that may have slowed or become incomplete. Research examining dextrose prolotherapy for chronic plantar fascia pain has reported improvements in both pain and function. Some studies have also identified a reduction in plantar fascia thickness following treatment, which may represent an improvement in the underlying tissue condition. Prolotherapy has several practical advantages. It is performed in the clinic, does not require blood collection, and is generally less expensive than PRP. Depending on the severity and duration of the condition, a planned series of injections may be recommended. The second treatment is platelet-rich plasma or PRP. PRP uses the healing potential within your own blood. A small quantity of blood is collected from your arm and placed into a centrifuge. The centrifuge separates the different components of the blood and produces plasma containing a concentrated number of platelets. Platelets are commonly associated with blood clotting, but they also store and release growth factors and signaling proteins involved in tissue healing. The prepared PRP is injected directly into the damaged section of the plantar fascia, where it can support the body's repair response. Because PRP is produced from your own blood, the risk of an allergic reaction is very low. Clinical studies and systematic reviews support PRP as a useful treatment for chronic plantar fascia pain. Improvements may continue to develop over several weeks or months because the objective is progressive tissue recovery rather than immediate numbing of the painful area. When PRP has been compared with corticosteroid injections, corticosteroids can provide faster short-term relief. However, PRP has often produced better pain and functional outcomes at approximately 3 to 6 months. This makes sense when we consider the different objectives of these treatments. Corticosteroids primarily reduce inflammation, whereas PRP is intended to encourage a biological repair response in degenerative tissue. PRP has also been compared with shockwave therapy. Both can be effective treatments for plantar fascia pain. PRP may be particularly valuable when shockwave therapy and an appropriate rehabilitation program have already been attempted, but the plantar fascia remains painful and structurally abnormal. So, should someone choose prolotherapy or PRP? Both treatments may be useful. The right choice depends on several factors, including the duration and severity of the heel pain, the ultrasound findings, previous treatments, medical history, treatment cost and personal preference. Prolotherapy offers a straightforward and cost-effective regenerative approach. It may be particularly suitable when a series of treatments is appropriate. PRP provides a concentrated preparation of the patient's own platelets and associated growth factors. It may be preferred when there is more established plantar fascia degeneration or when previous conservative treatment has not produced sufficient improvement. The available research has found improvements with both treatments. Rather than assuming that the more expensive option is automatically better, I recommend selecting the treatment that best matches the patient's particular condition. Accurate placement of the injection is also very important. These procedures are carried out under ultrasound guidance. This allows us to see the plantar fascia throughout the procedure, locate the abnormal tissue, and guide the needle into the intended treatment area. It also allows us to avoid nearby structures and tailor the injection to the individual ultrasound findings rather than relying only on the location of tenderness. I use ultrasound-guided local anesthetic before administering the regenerative injection. This makes the treatment much more comfortable and is particularly helpful for people who are anxious about injections or who have previously experienced a painful heel procedure. I do the PRP injections with a doctor colleague of mine, meaning we can also offer nitrous oxide, known as laughing gas. If patients are particularly nervous, the treatment is performed in my clinic. It does not require hospital admission or a general anesthetic, and patients can usually leave shortly afterwards. Some temporary soreness is expected after prolotherapy or PRP because the treatment is designed to stimulate a local response. This is usually manageable and settles as the initial reaction subsides. As with any injection, there are potential risks, including bruising, bleeding, infection, nerve irritation, or a temporary increase in pain. These complications are uncommon when the procedure is performed using appropriate sterile technique and ultrasound guidance. Before treatment, I review medications and relevant medical conditions. People taking blood-thinning medication should never stop it without advice from the doctor responsible for prescribing and managing it. The injection itself is only one part of the recovery process. Once the regenerative injection has created an opportunity for tissue healing, the plantar fascia needs to be gradually returned to activity. This usually involves progressive strengthening of the calf and foot, appropriate footwear, temporary load modification, and correction of relevant biomechanical factors. Orthoses may also be useful when there is a clear mechanical indication for their prescription. The objective is to improve the capacity of the plantar fascia so that it can tolerate standing, walking, and exercise more comfortably. Combining the injection with a structured rehabilitation program gives the treatment the best opportunity to succeed. Regenerative injections are particularly worth considering when heel pain has persisted for several months. Imaging confirms plantar fascia degeneration, and a properly directed conservative treatment program has not provided sufficient improvement. They may also provide an additional non-surgical option before an operation is considered. The key message is that chronic heel pain does not necessarily mean you have exhausted your treatment options. Prolotherapy and PRP allow us to approach chronic plantar fasciosis differently. Instead of only trying to control the symptoms, these treatments are intended to encourage the body's repair response within the affected tissue. With the correct diagnosis, accurate ultrasound-guided treatment, and an appropriate rehabilitation program, regenerative injections can offer a worthwhile pathway towards reduced pain and improved function. If your heel pain has continued despite previous treatment, it may be time to have the diagnosis reassessed and determine whether prolotherapy or PRP is suitable for you. Thank you for watching. If you found this helpful, please like, subscribe, and I'll see you in the next video.